coordinator of the Canada Health Coalition. The subject is Canada's health system and the attacks on it being waged by in the context of the U.S. healthcare debate, the silence of our prime minister, and what may be happening below the radar with Canada's health system. So, I guess I'd ask Mike first for your general comments on our federal government's quiescence around the American healthcare debate and what may be actually happening below the surface.
Hmm. Well, Ish, those are good questions. I think that it's been very dramatic, the silence from the Prime Minister on that whole U.S. debate and the campaign to malign and stir up fear in the United States with misrepresentation of Canada's healthcare system, including saturation television ads funded by the insurance industry featuring Dr. Brian Day from Vancouver. No rebuttal, no response from the Government of Canada, no defense of the facts that and the truth about the success of Medicare in Canada. In fact, the Prime Minister had an opportunity in a press conference with Obama and the President of Mexico earlier in June. And the question came up, and Obama was talking more about Canada's healthcare system than the Prime Minister of Canada. The only thing the Prime Minister of Canada had to say about Medicare was that it had nothing to do with the Government of Canada. It was a provincial jurisdiction, which is a complete misrepresentation. The Prime Minister of Canada has a statutory duty to enforce the Canada Health Act, which provides the national standards for Medicare in Canada. So he was denying the role of the federal government in Medicare, and of course failed as well to defend Canada from the misrepresentations. So it's very serious.
Yeah, I find that actually quite shocking when you think about it. The Canada Health Act is the Canada Health Act.
Yeah, that's right. It's not provincial. It was passed in Parliament unanimously in 1984. All parties from all provinces, including the province of Quebec. So the notion that healthcare is exclusively provincial is absolutely false. To have national standards, the Government of Canada used the spending power, which is in our Constitution. There's nothing unconstitutional about the Canada Health Act. And to establish national standards, that's why you use the federal spending power. And any province is free to leave the money in Ottawa. If you don't want the Government of Canada check with health transfers, you don't have to take it. But if you do take the money in the health transfers, and every province takes the money, then you have to live by the standards, which include no extra billing, no user fees, no queue jumping.
We know that Stephen Harper, with all his political background, the Reform Party, the National Citizens Coalition, has always been an opponent of Medicare. Now he's staying mum on it. What is actually happening below the surface with the government? What's happening at Health Canada?
Well, I mean, below the surface, he's giving a nod and a wink to the provinces to go ahead and privatize the delivery of their system. And British Columbia and Alberta and Quebec are taking him up on that. They know that the dog in Ottawa will not hunt. There is no enforcement of the Canada Health Act. They're looking the other way and quietly telling them to go ahead and, according to the Conservative platform, quote, experiment in private delivery, unquote. Now, what they're not saying to the people of Canada is there's no experiment in privatized delivery. Under the free trade agreements, whether it's the WTO and the GATS or the NAFTA, Medicare is only protected to the extent that it's non-commercially delivered. The minute you commercialize a service, you lose the protection from the trade agreements. So that's not an experiment. And that's very dishonest to describe it as an experiment in privatization. So he's encouraging them to do that. And with that, of course, the concern is that it violates the Canada Health Act because you can't have an economically viable private system without charging people. And that's where you break the federal law. So we have illegal billing taking place. Canadians are being charged illegally by private for-profit clinics for medically insured services. Now that is strictly against the letter of the law in the Canada Health Act, and the Government of Canada is not enforcing the law.
Does the development of these private clinics that you tend to be specialized around particular medical procedures, does that open up all of Medicare, all of the Canadian health system to challenge under NAFTA law?
Well, I mean, we've seen some pretty bizarre legal challenges to Medicare, starting with Jacques Chaouli, the Quebec doctor, uh, who challenged the constitutionality of the Quebec health insurance laws. And those laws are struck down by the Supreme Court of Canada, which was completely outrageous because it was rejected at the Quebec court, thrown out for lack of evidence, and accepted at the Supreme Court without any evidence. So the lower court threw the case out because there was no evidence, and the Supreme Court of Canada ruled in favor of Jacques Chaouli without any evidence. So it was an ideological decision to break Medicare in Quebec. So those who are trying to commercialize are using that as a political weapon to try to make it look like governments have to open up the system to private delivery, which is not the case whatsoever. It's a misrepresentation of the Supreme Court ruling. But that's the kind of thing that's happening in terms of a very serious situation. Now, in addition to Jacques Chaouli, there's also Dr. Brian Day, who was part of the Supreme Court challenge, and now he has launched a new case emanating out of Vancouver in British Columbia, another charter challenge to the BC Medicare laws.
Similar to the Quebec challenge.
Similar, yeah, based on the so-called charter rights for a doctor to charge whatever he wants to for whatever he wants. What's interesting about Dr. Brian Day, and people need to know this because these are facts filed by the government of British Columbia in the court case. Dr. Brian Day is suspected of illegal billing, that he's charging for insured services, charging the patients, turning around and also charging the government of British Columbia. And in addition to that, he enforces his patients. Any patient of Dr. Brian Day in the Canby Clinic in Vancouver has to sign a confidentiality agreement, which is actually forcing them to sign a false statement. The confidentiality agreement says that the insured service is not an insured service. So you falsify a statement in an attempt not to get fined by the government of British Columbia. So it's just outrageous, the kind of thing. And then on top of that, if that's not bad enough, breaking the law twice like that, he's also banned the provincial auditor from inspecting his books, which is again completely outrageous. If you get any public payment in Canada, you are subject to auditing. That's a basic principle of public administration. So it's basically a state of lawlessness with Dr. Brian Day, that he is deliberately flaunting the law. Fortunately, the government of British Columbia is going after him.
Is there a connection between Brian Day and the politicians, the conservative politicians, Stephen Harper?
Well, I mean, they're fellow travelers in terms of being radical libertarians. Dr. Brian Day has called for the abolition of the Canada Health Act. He does not believe in public health care whatsoever. That was in his presentation to the Romano Commission. He's since tried to deny that, but that's where he's coming from. And we know that the Prime Minister of Canada has said repeatedly that all taxes are bad. That's a pretty radical statement for a Prime Minister of a country to say that all taxes are bad. What that means then is that all public programs are bad. And it also means that he doesn't believe in funding Medicare out of taxpayers' revenues. So it's pretty radical. They're both coming from the same place, but Stephen Harper knows he can't talk about this publicly and openly because he also can read the polls, and the polls show that about 86 to 88% of Canadians believe strongly in the public system, in the values of the public system, and in the fairness of the public system. They want that protected. They want the problems in the public system fixed. They don't want the system Americanized by opening up a private tier for those who have the money.